Okay.
We can start. Okay.
We can start. Very well.
The second patient.
Second patient is a woman. Quanti anni ha?
54.
Okay, 54 years old, and now I show the treatment of the arms and after of gluteus. So we can see the laxity of this tissue, and the treatment of the arms is very important to obtain, to tone the tissue, the underskin tissue. Is different from gluteus because on the gluteus I go to do a reshape, a volume of the area. In this case, I can obtain a reshape of the tone of underskin tissue. So here, the laxity is very important in this point. So I can do this area and my access point I do here. The technique is the same of gluteus. So local anesthesia in the access point, and after with the cannula and fan technique, I go to inject the product. L'altro braccio. Okay, other side is very similar. My access point and my area is this. Okay. So I hope that is very, you can see very well with the camera. Okay, so let's start. Venga signora. Giù sdraiata. Testa di qua.
The molecular weight of product is 1,800,000 kilodalton.
Of the area, the access point. In the same patient, after the treatment of the arms, I perform a treatment of gluteus. Da quale vuoi che parta? Okay, so first I perform the right side of the patient. Disinfection. Anesthesia. Such of cannula. Okay.
Se vuoi un po' di disinfettante per le mani. Hello.
Entry on the access point. Okay. Now I go with the same technique of the gluteus. Signora, ha dolore? No. Ok, perfetto. Ok, I start. I can show you the cannula. Okay. Superficial plane to tone the underskin tissue. Può sentire un pochino di fastidio a tratti. Fossettine, signore. Dolore forte non dovrebbe sentirlo. Ok, no pain. To obtain the tone of this area is not necessary to inject a lot of quantity of product, but in this way I will do 1 vial per side, one in the right side and one on the left side. It's different treatment.
What size needle for numbing and how much to inject, sorry. Needle for numbing, I think l'ago quello che usi te per l'accesso.
Sì, the needle for access, I use the no-core needle. The no-core needle is a needle of 18 gauge, but has a microblade.
Yes, the characteristic is of this needle is the la lama, come si dice?
Blade.
The blade, sorry, the blade.
Microblade. Or blade number 11.
It's possible to show you after this?
Yeah.
Okay.
So, I'm done 1 vial. I finish. Now, little massage, short massage of the area. Have you pain? Ha avuto dolore, signora? No. No pain. Okay? The access point. Very small. So don't do stitches, but only very strict medication.
Please stand up model. Yes, a moment. Ma vede la differenza magari tra me?
I show you the difference between the right side and the left side not yet injected. Just a moment, I put the medication and after I show you. Tutto bene, signora? Ha avuto dolore? Ok. For the patient, is the first time of this technique, so I prefer in this side to put only 1 vials. I can inject, I think, 2 vials maximum in this case, but I prefer 1 now, and if the patient wants, in the next weeks, we can perform another vials for site. Okay, medication, and now I show the difference between left side and right side. Okay. So we can see in this position, but also I show you in stand-up position.
Sulla frontale. Intanto, ok.
We can see the difference of the tone of the skin and the underskin tissue.
No, Michele, quell'altra inquadratura. Questa. Ok? E poi le fai vedere in piedi.
The tone is very different. This way, this side, not yet injected, and this side. Signora, si può alzare un attimo? Ok, sempre rivolta verso la telecamera. Quella. Quindi, sollevi così. Ok. So, this way, this side. Only one vials. And this, we can see the difference of the tone, the tissue.
The filming is very important in this case. Filming action.
Yeah. Okay.
Okay?
Other side, same technique. So, local anesthesia, the first step, in my experience, is absolutely necessary local anesthesia. Signora, come prima, piccolo buchino, sentirà bruciare. Scusi, sorry for the pain. Okay. Also, local anesthesia is necessary to perform in the superficial plane, okay? Under the skin, and not in deep plane. Ok, aspettiamo un attimo. We're waiting for a minute to the local anesthesia effect. Before you ask that show you the knocker blade, the knocker needle. The knocker needle is this. This is and now I show you also the needle.
The other part, the pack.
Yeah.
Okay. Yes.
And after I show you without packaging.
Yes.
This is a packaging, and it's a 18 gauge needle, but with a microblade. Okay? So, I do the access point.
If you have the question, it's possible to text in the question. Okay?
Okay. Okay, I go through my access point and start the treatment. Qualche scossettina. Okay. Okay, superficial plane, under skin superficial plane, not a deep plane, but very superficial. In this area is very important, more than gluteus area, to stay in the superficial plane, because I don't go to do a volume, but only tone to the tissue, okay? So if I stay in the deep plane, the deeper plane, I can't obtain the tone of the tissue, but only volume, okay? So, start. Fan technique. Tutto bene, signora?
Tutto bene, grazie.
Ok. No pain, the patient. Okay. Okay. With the second hand, with the left hand, I help the progression of the cannula in the tissue. In this way, okay. Tutto bene, signora?
Mm-hmm.
Ok. That feel a strange sensation of the area is normal, but not pain. Okay. I finish, okay. I remove the cannula. No bleeding, very small access point. So the pressure and short and easy massage of the area. Tutto fatto, eh? Ha dolore?
No.
Oh, può dire anche di sì, eh? Ok. Okay. So I put the medication and I show you the treatment, the finished treatment.
Who is the question? This one. There isn't the question, and then pass to the treatment of the gluteus.
Okay, very well. So you see, we can see a different gluteus than the other patient because the age is different. Ok, tutto bene? Okay. Allora, si può alzare, signora? Allora, magari si toglie un attimo scarpe e pantaloni. Guarda, si può mettere magari così si appoggia al lettino. Just a moment till the patient is ready. And we start with the gluteus area. Okay. I show you the gluteus of the patient and my pencil is here. Okay, venga signora. No, venga qua. Come here. Okay. Okay. Very well. So, in this case, the gluteus is different because the age is different. Then, sorry for. And I have to do a treatment of this area because the tissue are more laxity than the patient, the other patient. So, in the same way, I perform the access point on the medial area. The access point I can perform here, or usually in the lateral position, I prefer this point because, okay, this point, okay, to perform a treatment of the trochanteric and pretrochanteric area. I prefer this point and not the point below of the slip because usually I perform this treatment in the summer and spring. So if I perform the access point above the line under the slip, I have no problem with the sun, okay? The area is the same area, the higher area of gluteus. Scusi signora, sorry. To obtain the higher position of the gluteus. Okay, this is my draw. So, let's start. Venga qua, signora. Action. Local anesthesia. The steps are the same. Disinfection, local anesthesia, and start. Okay, a little bit of pain now. Sorry. We can see the contraction of the gluteus. Okay, we perform the local anesthesia in the other side. Sorry. Scusi, finito tutto. Ok. Sono stato cattivo. Ok. 1 minute and we can start. Okay, I start. Mi dica se ha dolore. Dolore?
No.
Ok, no pain. Se ha dolore me lo deve dire, eh?
Mhm.
If you have pain, tell me. This is my access point. Okay. Allora, and I control my access point with my cannulas, very small, my access point, so the difficulty is to, sorry. Okay, I perform better. Ha dolore, signora? Ok, no pain. Ok. I am in the correct plane. Ok. Superficial plane above the muscles fascia and start with the injection. I follow my draw. Allora, fastidio normale, signora. Ora dolore? Anche adesso?
No.
Ok, no pain. Before a little bit. Dolore? Pain?
Non si sente.
Sente la dilatazione?
No.
Ok, so first vials. Remove the vials. Second vials. Okay. In this case is the first time when the patient underwent to this treatment. So with the patient, I am in agreement to perform 2 vials per side on the gluteus area. Pain. Okay. Quasi finito. I have just finished. The last. Ultimo passaggio, signora. Ok. Perform a massage of the area. Un pochino il massaggio, signora, per stendere la zona. Ok. This is my access point. No bleeding. Put the medication. And I go to perform the other side. Sto mettendo il cerottino, signora? Ok. No. The other side. Access point. Dolore? Pain? Ok, no pain. Dolore? Pain? No, ok. Ok. Parto, signora? Let's start. Dolore?
No.
Ok. Technique is the same. Fan technique. With the second hand, with the left hand that help the passage of the cannula. Dolore adesso? Pain?
Ora meno.
Ora meno. Less than before. Ok. I change the vials. Abbiamo finito, signore? The last vials. Faccio l'ultima fiala, ok? Bene. I speak with the patient that this is the last vials of the treatment. one technique. Quasi finito, signora. I have one minute and I finish the treatment. Okay, finish. Pressure and short massage of the area. Okay.
There is a question, Marco. Do the patients have to take any precautions after the treatment?
No, after the treatment, there aren't precautions. So the patients can come back to the normal life. So sports, work, and so on.
Like avoiding any medication or avoiding sitting for a period of time? Okay.
Very, very small. So usually I see the patient at 1 week than treatment, and I show if there is any complication, but usually there aren't complications if the technique is well done.
And then another, which opera you suggest for vaginal rejuvenation and filler or vaginal treatments?
In vaginals?
Yes. I think the best product for this treatment is Opéra IV, extra strong filler.
Rev opera.
Yes.
With body filler, I never do treatment of vagina.
We don't have experience for this treatment.
Of the body filler are claves, are gluteus, and arms. So vagina, I think that is not recommendation for Opéra V. Ok, signora, abbiamo finito. Sopravvissuta?
Sì, sì.
Ok, so we are ready.
Okay, finish this treatment. There is the question.
Signora, si può alzare? Attenzione.
Sono a posto.
No, ho visto...
No, sono a posto.
Ok. This is the result with only 2 vials per side. 2 in the right side and 2 in the left side. Okay?
Ancora un po'? Ancora un po'? Ancora un po'? Ok. No, rimetti sul profilo? Ok. In there, danger for pressing the sciatic nerve with that large quantity of filler in that area. The problem in the gluteus for the sciatic nerve.
On the gluteus. No, when the plane is correct, the plane must be superficial plane above the fascia, okay? Is impossible to obtain a compression of the nerve and important vessels. So, but the plane must be superficial plane, okay? Above the fascia, in the underskin tissue.